Is the COVID third wave officially here in India, spurred on by the Omicron variant? And as it descends upon our country, are our politicians taking us for a ride? I'm Barkha Dutt and you're with the Mojo Story, and that is our big focus on the program today. A slew of measures by different state governments across the country seem to be, in my opinion at least, anti science. These measures literally make no sense, from night curfews to the sealing of buildings to the closure of schools. They seem to suggest that we have learned very little after 2 years, and we're treating the beginning of 2022 as if it were still 2020. Is this to create the illusion of action when nothing much can in fact be done? Because remember, this is a variant that might already be in community transmission. Instead of the focus being on vaccines, on testing, on genome sequencing, on vaccine mandates, on masking, on ventilation, we are distracted now by an odd even plan in Delhi, by night curfews in a slew of states, and many state governments banning New Year parties, even if they're held in the open, but not banning, guess what? Election rallies. That certainly triggers a sense of deja vu. Let's introduce our panel of experts on the program today as we ask a fundamental question. If the third wave is here, how should we not be responding? And are we doing exactly what we should not be doing? Is it all meaningless? Is it all designed to throw wool over our eyes? Joining us on the program, Dr. Swapneil Parikh. He's, of course, an author and a physician and has done some very important work at the COVID frontlines. We're also joined by Chandrakant Lahariya. Dr. Chandrakant Lahariya is one of our foremost epidemiologists. Though boosters are coming to India and are already here, he's not convinced that the basis for either those or children's vaccines is sound. We're also joined from Mumbai, from Maharashtra today by Dr. Amit Thadani with the Nirmaya Hospital, also been a frontline warrior. Subhashini Ali, left politician, is joining us as Kerala is one of those states which is announcing a slew of restrictions, and we hope to have the Aam Aadmi Party, Sanjeev Jha, who's having bandwidth issues with us very soon as well. So let me start with you, Dr. Thadani, if I may. What are you seeing in Maharashtra? We're seeing doctors from Mumbai talk about an upswing, an uptick in the cases. Maharashtra has always led. If you follow the pattern of the waves, it's kind of started with Maharashtra and then come to waves in the rest of the country. What are you seeing, sir, on the ground?
Yes, hi, Barkha, and thank you for having me over. And yes, there is definitely an uptick, sharp uptick in the number of fresh cases. There's no doubt about it, and we are seeing that reflecting on the ground as well. But I mean, all the patients I have seen so far are all home isolation patients who are really not sick as such. Most of them have been asymptomatic and tested because someone else in contact with them have tested positive. So most of them don't seem to be having any symptoms. But then, early in the wave, we do keep getting all the mild cases, and the more severe ones generally follow in the mid and the second half of the wave. So it's a little early, to be sure as to what exactly is going on right now.
But Amit, I've I've been talking to a whole host of South African doctors as well as doctors from United Kingdom, and they're all saying that there is a difference between Omicron and Delta. They're not seeing any oxygen levels falling. They're not seeing any hit to the respiratory system. They're not even necessarily seeing fever. Instead, Omicron patients are reporting muscular pain for the most part. And Angelique Coetzee, who first found the Omicron variant on an antigen test, said she's using Brufen to treat her patients. So I'm just struck by the fact that you said that most patients are home isolation so far. Do you not think that we in fact need clear communication from all state governments to not panic and to not go rushing into hospital? And we're not seeing that communication at all coming from anywhere. Amit?
That's the whole problem, actually. That there's too much of undue panic as of now. And most likely this would turn out to be an Omicron wave. But what we've seen in other countries is that the number of positive cases are really massive. The number of admissions are nowhere close to that. And this has been the trend in South Africa, where the wave has already come and gone almost. It's the same trend again in the UK as well, where the number of, I mean, imagine you have 1 lakh new cases a day, and you have just about 700-800 hospitalizations, maybe 1,000 hospitalizations. It's actually pretty low when you look at the numbers. You see the numbers even for that matter in the United States, where it's about 2,70,000 new cases a day, and again the hospitals aren't overloaded yet. So I guess there is some element of overreaction which we are seeing as of now. We don't really need to panic as of now.
So let me ask you this. I saw on your Twitter feed that you were very displeased or amused or bemused with some of the restrictions in your state of Maharashtra. And of course, the irony is that election rallies continue to be held. Now they're out in the open. But the fact is that we're not seeing any, for example, rule that says mandatory masking at election rallies. We could have at least that. On the one hand, you have that. On the other hand, you have schools, at least in Delhi, have been closed. You have weddings restricted. You have New Year celebrations banned, even in Mumbai, in the BMC jurisdiction. What do you make of, and we're seeing some of those mammoth election sabhas, what do you make of these restrictions?
Well, they are
Amit?
completely meaningless. Actually, they are completely meaningless. Really, I don't see any reason for people not to have get-togethers on the terraces of buildings. And I mean, imagine banning terrace party. The terrace is the safest possible place where you can be, right? It's ventilated on all four sides, and you want classroom windows to be open when you are conducting school. But a completely 360-degree open structure isn't safe enough for you. It's
Yeah.
ridiculous, the kind of measures that are being instigated. Imagine open air, the stadium, 25% capacity allowed. Any open air gathering for that matter, only 25% gathering allowed. Right? It's now pretty much proven everywhere across the world that open air gatherings are relatively safe. But you want to
Yeah.
allow 50%, indoor. And what's this silly thing about 50% capacity for home parties? I mean, what the hell does that even mean? Uh, half the people in the house supposed to go out or what?
Yeah.
It's
Yeah.
just
It
getting
actually
ridiculous.
makes Yeah, it actually makes such little sense. It reminds me, and let me take this to Dr. Swapneil Parikh now. It reminds me of that time when I remember, I think it was in the first wave when parks were closed. Even in the second wave, for a time, in many cities, public parks were closed. Even though in other countries, the one thing you were allowed to do was to go out, even in a lockdown, for a walk for 1 hour. So our politicians, in a sense, either don't get it, or they're being advised wrong, or they just want to buy time and create the impression that something's happening. Swapnil, I know you and I kind of disagree on measures. We sometimes have argued about this. First, let's look at, let me address the elephant in the room. Is If Omicron is galloping, if it is in community transmission, these old test and trace, confine, isolate, quarantine, institutional quarantine, all of this makes zero sense.
So let's first state that we cannot categorically say that this surge is due to Omicron because we don't have, the sequences to say that. But with a little bit of common sense, based on the fact that Delta transmission was so low in India, in many parts of the country. It was high in some parts of the country, but by and large was low. Mumbai in particular. And then we suddenly have an uptick just when we are seeing Omicron outcompete Delta in numerous other countries. So it is a bit of an assumption, but I think it's a relatively safe assumption to say the growth that we are seeing right now is fueled by the spread of Omicron. I will just add in a few differences in what I am seeing in patients. So I have seen a couple of patients develop COVID-19 pneumonia, despite two patients so far, despite having been fully vaccinated. They completed their last dose, several months ago. But interestingly enough, neither of them desaturated. So they did have clinical evidence of pneumonia, but they did not need oxygen therapy. Their oxygen levels did not decrease. They did need hospitalization. They were uncomfortable. Have been noticing a lot of sore throat, body ache. Some patients are having, high fever. Generally, the ones who don't have a past history of COVID-19. one of the interesting things I've observed so far is I haven't seen too much anosmia. So that's a change or loss in the sense of smell. I haven't by and large been seeing that in patients. So that's been interesting because I saw a lot of that in the second wave. Coming to the restrictions, we are in this kind of place right now where there is a need to kind of react because with when we have a variant that is moving this fast, and there is still some uncertainty about what it's going to do to the health system. I think there is reasonable amount of evidence to say that at a individual level, if you're fully vaccinated or if you've had COVID-19 and now you're fully vaccinated, you have a high degree of protection from severe disease yourself. I think there's also some evidence to suggest that even individuals who have this so-called hybrid immunity are likely to have asymptomatic or mild infections and contribute to community transmission. They're likely to play a role in transmission, or more likely than they were earlier. So I think we're still likely to see a surge or a wave of infections cases with some amount of decoupling. The concern really becomes is that during the Delta wave, our health capacity didn't get exceeded by like 50% or just a little over health capacity. I was trying to admit patients at hospitals where I have worked, where I know the entire COVID unit, and I was told there's a waiting list of 70 beds, 70 patients for each bed. So even if it's much milder than the Delta wave, that's not what's relevant. Is it beyond our health capacity? That being said, the restriction should be based on science. So if the argument is made that okay, a venue needs 25% outdoor seating based on the number of toilets it has, because the toilets are an indoor space, that makes sense. But if an outdoor venue has it doesn't have any indoor contact whatsoever, then that's very safe. But by that same measure, if you have rallies, religious events where there are tens of thousands of people attending, there's bound to be indoor contact. How did they get there? How are they going back? Where are they going afterwards? Where are they eating? Where are they going to the toilet? So there are a lot of inconsistencies here, and it doesn't make sense. And if it doesn't make sense, you lose the public's buy-in, and compliance will plummet. You can have any number of protocols and laws on the books, but people need to actually follow them for them to have any effectiveness.
I mean, I've always argued that people have crossed a psychological threshold in this pandemic, and you've always made the point the virus doesn't care. But if people see mammoth rallies, and you're absolutely right, even if the rally is in outdoors, but as Amit said, if by contrast sporting events are stopped in outdoor stadiums, but outdoor rallies can take place, people are going to say politicians are just being hypocritical. And I'll put that to Subhashini in just a moment. But Chandrakant, let's bring you in. I know that you actually are not convinced of two of the measures that the government have taken that the rest of us have been advocating for: vaccines for children and booster shots. So far, the booster shots are restricted. They're not available for everybody. But the most egregious thing that has already happened in the capital, and I suspect it's going to happen everywhere, is the physical closure of schools. Chandrakant.
So, couple of things. First thing is that we need to remember what is the purpose of restriction, any form of restriction, and the worst or the extreme form of restriction is lockdown. India did, or many countries did lockdown. The idea was to prepare health system. We know that lockdown did not stop virus from entering into India, and then it is everywhere now in the country. So lockdown or restriction do not work. Their purpose is prepare health system. If India could not prepare health system in 21 months, it would never prepare health system. So that's one part. Second part is that the scientific intervention, be it a medical science or epidemiology, should be based upon evolving knowledge and understanding. Putting restrictions in December 2021 is like giving remdesivir or hydroxychloroquine to a person to treat COVID-19. It has no role and no relevance. Third part is that closure of the school, while there is a global evidence, international agencies have said that UNICEF, UNESCO, that school should be last to close, and there is ample evidence why school should be last to close. But this is the first thing which is being done, and I give you the reason why this is being done. What we see that majority of the people who are involved in COVID-19 task force have a limited understanding of epidemiology and public health. Epidemiology or public health is not about worst case scenario. If you have to follow every single time or 2 years into virus circulation, the worst case scenario, then why are you there? Science tells us that we should not be doing worst case scenario, but majority of people are going on worst case scenario. That's one. Second thing, majority of people are doing, they are following that because it is happening in UK, because it's happening in Sweden, because it's happening in United States, it will happen in India. But that's not the way. What we need to remember, for just today, there are two studies. One, rather, a few days back, South Africa has changed its COVID-19 containment and management guidelines. It has said that there is no need of contact tracing. South Africa has said that there is no need of testing asymptomatic or mild symptomatic. So countries are evolving, but we simply conveniently pick because people don't have that kind of granular understanding of what is the right epidemiology response, and they are reading on the Twitter and social media and conveniently in the free
And
time doing.
I think the most important point that you make is 2 years into the pandemic, you cannot be using instruments of 2 years ago. And that is exactly what parties
And
across party lines are doing. Yes, Chandrakant, complete your point
the
quickly, then I'll
final
go to
point is that
Subhashini.
today
Yeah.
only, this study has been quoted in New York Times and other places. What has been found that people who develop Omicron infection in South Africa, they studied 33 number, but this is a biological study, so this number is fine. What they found that people who developed Omicron, and if they had a past infection, the amount of antibody produced by them after Omicron infection was 14-fold higher, and all of them developed mild infection. So what it is conveying, that Omicron is a mild infection, it produces antibody. So in actually, it is resulting in that scenario where exposure to Omicron to an individual actually can result that it will replace Delta in due course, because there would be more antibody. It will prepare us for future scenario where it will become a mild disease and will be out of the.
Yeah, and analogies are being drawn with the Spanish flu, that is how the pandemic ended in India. I know Swapneil has a different perspective, but I just want to get in a political perspective now. Kerala is among the states that has imposed sort of the kind of restrictions that I personally think have no meaning. The doctors agree they have no meaning. Omicron doesn't just come out at night. Omicron doesn't hide in buildings, that if you seal the buildings, you'll catch it. Omicron doesn't, attend weddings and not attend election rallies. So, Hashni, I think there's a sense of disillusionment among the public that, there's almost a kind of meme making, a kind of joke cracking, disillusionment in a cynicism, because it's almost like state governments don't know what to do, so they're just doing the same old thing.
See, I think that you're mixing many things up together. See, we have a central government and a central election commission which decides about elections. The state governments have very little role to play. It is they who decide whether elections are going to be held, and they also decide what are the rules to be followed in those elections. Now, we saw what happened last year. I think that all those rallies and those 8 rounds of electioneering in Bengal were all very disastrous decisions. So I think that that was something that should not have happened. The Kumbh was something that should not have happened. So basically, we have to see who is responsible for organizing electioneering and giving permissions for religious gatherings in our country. And certainly, there are many things that we can object to, because some religious gatherings are allowed and gatherings of other religions are come down upon very heavily. So that's also something that we should be taking note of. Christmas is not allowed, and all the other sort of Hindu festivals are allowed. Eid has not been allowed for 2 years now. So 4 Eids have not been allowed.
Kerala did
Yeah,
allow
please.
Eid celebrations. Kerala
No,
did.
they didn't allow
I
Eid.
remember
They didn't
discussing
allow Eid.
it with
They didn't
them.
allow Eid. I'm talking first about the central government. The
Mm.
Eid that was allowed in Kerala was 3 days of shopping was allowed in Eid, but prayers in the open were not allowed. So these are distinctions that we have to make. Now, when you're talking about Kerala's restrictions now, as far as I can tell, they have not put in night curfew permanently. What they've said is after, I think, 10:30 or something, because right now is the very peak season in Kerala, and it's not cold there. So every night there are huge gatherings outside, especially on the 31st night. And maybe, I don't know, maybe they have done a correct thing, I'm not sure. But very, very huge gatherings at night, even if they're in the open, may not be a very good idea. So maybe that's not a bad thing. The one thing I'm happy that they're doing in Kerala is they're also upping their oxygen supplies. They're upping their production of oxygen so that they're not caught unawares if the need for oxygen beds once again increases like it did last time. They should be prepared for it. The other thing that they've done in Kerala, which I see in, say, comparison to Uttar Pradesh, is that there's been much more vaccination in Kerala. I believe that 98% have had one vaccination, 77% have had both. This is what I read today. Maybe I'm right, maybe I'm wrong,
Okay.
but it seems that they have done a successful, achieved a successful rate of vaccination. Now, when we are coming to what governments should do, I think it's very, very important to see what governments like Bihar and UP should do, because they are the huge states. It
But
is
at the
UP that
moment, let me just jump in here. At the moment, the most contentious measures have come from Delhi, where the Aam Aadmi Party spokesperson was with us at the beginning of this program and has obviously lost his connection. But we're actually seeing a kind of farcical odd-even formula for non-essential shops. We're seeing Mr. Kejriwal himself go and campaign in Punjab, but asking people to close schools, to not send their children to school. So this is when people see this gap between how political behavior, and I'm not making this about any one party. These are the lines outside metro stations. Yes, metro stations in Delhi. I just want to bring in Amit and then
no,
Swapneil.
Barkha, let
Yeah,
me finish, please.
yeah,
See, you
okay.
concentrate on small fry. Who's campaigning the most without a mask? It's the Prime Minister of our country. He is addressing the maximum number of rallies in Uttar Pradesh and other
Everybody is
places.
campaigning without masks. Mr.
No,
Modi
no.
is, and
So
so is
no,
everybody
no. So
else.
you think that the Prime Minister campaigning and attending large rallies without a mask is equivalent to anybody else doing it? He's the one who takes a decision whether rallies are going to be permitted or not. It's his election commission that takes that decision. So let's place responsibility where responsibility should be placed. Who are these people? We know who they are. They have decided that they're going for the election. The election commission has decided there's going to be an election. The prime minister decided that they're going to be rallies. Now, if the ruling party is going to have rallies, opposition parties have to have rallies too. So, I mean,
Okay,
if you are deciding that there should be no rallies, then it should be the central government that we place the demand in front of, that please do not allow rallies.
okay.
You
Let me
should
let me
talk to
come in
the
now.
Central Election Commission. Please do not
Let me come
allow
in now.
rallies. That's very important. Now,
Let me
the
come in
second thing
now.
is
Yeah, yeah.
that below 18, nobody is vaccinated. I think that's a very frightening figure. We have such a huge under 18 population. So, like
Okay,
between 15 and 18, these huge numbers of non vaccinated people, I think they should be a priority. I think that vaccination needs to be a priority. And then in a
okay.
state like Uttar Pradesh, is any testing happening at all?
Okay,
They're
hang on, hang
saying
on.
some.
Made a lot of different points. Let me take some of them to the panel now. Let me get Dr. Amit first. Amit, the
I'm
point is 1 minute, Subhashini, I have to go on to the others now. The point is that every party will hold the other party responsible. But to my mind, yes, there's a point that the cues must be taken from the top. And in fact, I was talking to Dr. Ashish Jha at Brown University, and he said he thought election rallies could go on as long as masks were made mandatory. Swapneil totally disagreed. What do you think? Do you think election rallies? I mean, the messaging is all confused. You can't tell people that you restrict your weddings to 20 people or 50 people or 100 people and then see 10,000 people at an election rally. You can't tell people, okay, we'll play cricket without audiences, even in outdoor stadiums, but we'll go and campaign. So if a lot hasn't changed from 2020 and 2021, political behavior hasn't changed either. Amit.
Yes, so if everything else can be digital, even election campaigning can be digital, right? So you don't really need such mass gatherings of lakhs of people. You need it for political reasons. You're doing it for political reasons, right? All parties are doing it. There's no point of singling out any party in particular. Now, politicians are the safest in this because all the politicians are in the bubble, right? They have been provided bubble, and people around them are tested prior to all the rallies. But it's the common people at the end of the day who are going to take away, infections from there.
Yeah.
If you're looking at it from the other perspective, that okay, nothing really is going to happen. Everyone is going to develop herd immunity, and nobody is really going to fall ill. Then why are you putting restrictions for others? It doesn't make sense either way, right? So as far as vaccinations are concerned, it's definitely helped a lot. I mean, there's no doubt about it. The mortality is not going to be nowhere close to what we had earlier as such. Of course, many states, because of their size, have not done absolute numbers which are very high. Like smaller states like Kerala are always going to show up better. Like small states like Himachal have already achieved 100% vaccination months back. So small states have an inherent advantage as larger states, which is of course going to take time by comparison as such. Now, with regard to the restrictions, I think I made my point very clear that these restrictions were, as I agree with Dr. Lahariya completely, the restrictions were, would have made sense 2 years back when you were trying to prevent the entry of the virus into the community. As of now, the virus is very much prevalent in the community. We have Delta, we have it literally everywhere. I mean, come on, 79-80% of the population has tested, at least a representative sample has tested positive for antibodies. That means literally every single rural area and every single urban area, the virus is already present in a good amount, right? So
Yeah.
what exactly are we protecting against, right? It
Yeah.
makes no sense at all. I mean, the disease is going to now show, periodic waves, as you can say, because it's already there. Not only in the human population. If you look at some of the studies which are done in animal population, there are animal reservoirs now, right? In the zoos, lions have got COVID. Now there was a very recent article I read in which deer, have tested COVID positive.
Right.
So
So let me, I
we can't
completely
get
agree with
this
you that
anymore.
I actually think there's an absence of being blunt with the population, with the people. But basically, I think, the Delhi health minister did indicate this today by saying that a lot of people are going to get infected. Swapneil, you have not bought into the logic of, so far, of there being a kind of inevitability, as it were, to the Omicron infections, because you're making the point repeatedly that even if a small percentage needs hospitalization, the health systems will be snowed under. I believe the most important communication that needs to come from the government, all governments, is please do not go to hospital as an impulse, as the first response, which a lot of people do out of sheer panic. We saw that in the first wave, we saw it at the top of the second wave, till there was actual encouragement to isolate at home.
So first, let me just respond to about people panicking and going to hospital. Who are you going to call? It's that line from the Ghostbuster movie. Like, who are you going to call? Like when you test COVID positive, people are left on their own. They panic because they don't have a support system. Like Mumbai, at least during the second wave, had a triage system. You could call your ward room, you could call the ward war room, and they would direct you. They would telephone triage you and direct you. But for most people, there is no infrastructure, someone to allay their fears, tell them in that moment when you've tested positive what your next step is. So that, I think, is a health system failure that has occurred. I don't think we can put this on people at all. And I agree, the vast majority, I think we've known this for a while, the vast majority of COVID-19 patients, even more so in the post-vaccine era, can be managed at home. But who is going to reassure the patient in that moment
But that
that
is
that's
what the
the patient?
messaging should be right now. Instead of closing schools and imposing night curfews and sealing buildings, treating COVID as if it's a crime. I mean, the fact that we're back to resident associations sealing buildings, how is this even allowed?
Is not just about messaging though, Barkha. It's also about putting in the infrastructure. You can tell people like, okay, yeah, stay home, but they need to have someone to be able to call, right? Someone needs to be able to tell them, okay, the symptoms that you have right now require you to stay at home. And if you're developing these symptoms or you have started developing these symptoms, so you need to go to hospital. So yeah, I completely agree with you. We need to put out that messaging, but we also need to build those systems. Coming to a point about those restrictions, I diverge over here. So yes,
Okay.
one aspect of restrictions is to get the health system ready. The other aspect of the other reason for restrictions is to preserve health capacity. So now with in the initial period when there was less population immunity, the way we looked at restrictions was based on case numbers. If case numbers are rising very, very quickly, then we enact restrictions based on that. Now we know that there is a decoupling between infections, between cases and severe disease, at least clearly in those who are have been infected in the past, have been vaccinated, and there is some suggestive data that with Omicron that might be the case even in immunologically naive people. And I do believe that we are seriously underestimating the number of immunologically naive people in India, especially in
Explain
rural India.
immunologically naive to our general audience.
Sorry, I'll just get to that. I'll get to that in a second. So what I was getting to is when we look at restrictions, we have to have a provision that in the event we see either the absolute number or the rate and increase of hospital utilization, oxygen utilization, or ICU utilization. If we start seeing a sharp increase over there, that's when we have to be prepared at that point to say, okay, we need to level up our restrictions. because at that point you need to preserve the health system. So what immunologically naive means is an individual whose immune system has not experienced either the virus itself, that's SARS-CoV-2, or the COVID-19 vaccine. So the virus is still a new thing for them. Based on zero studies, we estimate that somewhere between 75 to 85% of the country has already been infected, and vaccination rates vary. So in a city like Mumbai, based on the past censuses, about 100% of adults have had their first dose, and over 80% have had their second dose. However, when you think about rural India, there was less exposure there, so less people were infected there.
I'm not sure. I traveled extensively through rural India. There was no testing happening in rural India, so we actually don't know how many people were
compared
infected.
to urban India, it's less dense. The zero studies show that there is a difference.
Yeah, there's more open air living, firstly, so that helps. But
so there's slightly less exposure than there is in urban India. There's less vaccine coverage in rural India compared to urban India.
Yeah, so
and most importantly, there's less health capacity. Like if people start falling sick over there, it's going to take a very small.
No, so how do these restrictions make sense? Given that, which of these restrictions make sense?
No, I started off by saying that the restrictions that we have enacted right now don't make sense. What I'm trying to tell you is we have to be prepared for the possibility that if there are different metrics, not just infections and cases, but if we start seeing hospital utilization at the local level, if we start seeing that hospitals can't manage the number of patients coming in, or it's increasing very sharply, or we are running out of oxygen, at that point we need restrictions.
Of course, or you need to be better prepared with field hospitals, with more oxygen, all of that. We need to also remember 2 years into this pandemic that there are people dying of tuberculosis, there are people dying of kidney disease, there are people dying of cancer. India's fight against tuberculosis has been reversed by years. Chandrakant, respond to what Swapneil is saying, that you have to keep health capacity in mind.
So let's remember the point which Swapneil made about decoupling infection from disease. And now remember one of the facts from India, and especially let's take example of Delhi. Delhi reported in the last 6 zero survey that 90% of Delhi's population, children 6 to 17 included, had developed antibodies. Now Delhi has 100% of the adult population received at least one shot. So this is a population where we know scientifically that natural infection provide the best form of protection from future severe disease, and then people are vaccinated, that adds on to it. So we know that.
But Omicron, you can get infected even if you've had Delta before. I just want to make that point.
Not Omicron, any variant. So in natural, so Delhi is in a situation. What do we want to achieve by putting restriction here? That's one part. And second part is evidence. People are conveniently picking that United Kingdom or South Africa had a high rate of hospitalization or high rate of infection, but the hospitalization in those settings were really, really low, even at that high rate of this thing. So why should we assume that India would have a very different hospitalization rate with a high infection, zero prevalence? Then coming to rural India, especially Uttar Pradesh, I want to say, and I strongly believe in this part, that UP in the June, UP, MP, Bihar, when the nationwide zero survey was done, had 70 to 80% zero positivity back then in June 2021. This 6 months since then, vaccination has happened, and they have either natural infection or vaccination in this immunity. So 90.
So are you counting on the fact that vast amounts of India is already infected to protect us against a third wave?
I'm saying third wave can happen if we look at only infections. Infection is nothing is preventing infection other than the face mask or physical distancing. But the outcome will be mild, or disease will not be severe in India. That is given from all the evidence. So people, when they say our health system will be overwhelmed or there will be severe disease, there is no evidence for that. That's what I'm saying. And that's why restriction has no value.
Okay, I want to take this to Subhashini Ali now, and then we'll take last comments. One of the things that has happened is that people on the left and the right, for example, I believe in vaccine mandates, and my friends argue with me saying, how can you give so much power to the state? I think, Subhashini, there's much more power we're giving to the state in allowing the state to create lockdown-like conditions, restrict our economic activity. And by the way, every set of restrictions, we know this now, hurts the poor the most. So, we're reaching this situation where we're handing over vast amounts of power to institutions of the state, much less so than if we just all agreed on vaccine mandates, compulsory vaccines to function.
Yeah, I said right in the beginning that vaccination was the main thing that should be pushed and there just should be no one left unvaccinated. And once again, I can talk more about UP because that's where I live. I know that there are thousands and thousands of people, even in big cities, who've not been able to access vaccination. The vaccines have to go to the people. The vaccines have to go to the slums, to the bastis, and to the villages, and vaccination must be the priority. Now, when you come to election rallies and all the rest of it, if you think they should be banned, then talk to the election commission about it and let everybody be banned. You can't have some people having rallies and some people not having. Just like you can't have some religions celebrating and some not being allowed to celebrate. These are things that have created a lot of hard feelings and they should not be encouraged. And I
Okay.
agree that many of the measures that are being taken are senseless. They just don't make any sense. And if they're senseless measures, we will find more and more people violating them. You find people not masking. You'll find people going in large crowds when it's not necessary. All that's going to happen because they don't see any logic in the restrictions that are being imposed.
Yeah.
So I'm all
Yeah. Sorry. Complete your point. Sorry. Go
so
ahead.
vaccination and preparedness. In UP, for
Yeah.
example, there's no preparedness. There's no infrastructure available if such a thing is needed. Again, I hope it's not going to be needed.
Okay.
But
Yeah.
the
Sorry.
scientific approach. Yeah,
Yes, the
I'm done.
scientific approach, the science is divided, unfortunately. Chandrakant, very quickly, because I know you don't agree with me on vaccine mandates. If you believe the restrictions are meaningless, we're entering a third
I'm
wave
only
with the
talking about
no,
vaccines, that's all.
yeah, I'm going to Chandrakant. Uh, uh, the state has to take some measures. Being prepared is one of them. Don't you think that asking somebody at a door of a restaurant to show proof that they've been vaccinated is much better than asking the restaurant to function at 50% capacity? Because most restaurants will shut down. Most small to medium size businesses, Chandrakant, will shut down at 50% capacity
Bharkaji,
again and again.
if your definition of vaccine mandate is asking a restaurant or somebody to facilitate entry to a particular place, that's a different
Yes,
understanding.
I'm
If
saying
you
link it. I'm saying link it to everyday life so that
well,
people
okay,
feel
that
the
is
need to go and get the vaccine.
that is agreeable. The way vaccine mandate is understood in a medical circle or public health circle is that people mandatorily need to get vaccinated. And that's where I do not agree. But of course, the vaccination status should determine the restrictions and different public places. That is what the approach should be followed rather than restriction. That there had to be a different approach for fully vaccinated individuals who should be allowed to go everywhere, while there should be partially vaccinated might have some restriction, and there should be major restriction on unvaccinated individual, and that is not vaccine mandate
Absolutely.
but following the approach epidemiologically. That is the right thing to be done at this stage rather than putting the restriction blanket that if you have a past infection and then you are vaccinated, then also you have to follow the same measure. Then what point that is make?
And also, it unmotivates people to be vaccinated. It makes the anti-vaxxer lobby stronger. Amit, if there's one piece of advice you'd want all politicians, all state governments to listen to at this point, what would it be?
You need to let people get on with their lives. You cannot go on doing these sort of restrictions. And maybe I would kind of disagree with even Dr. Lahariya on this point that having now we already know that the vaccination is not going to prevent transmission of infection per se. Vaccination is going to more likely cut the severity of the disease. So you're not going to even prevent transmission of disease by not allowing unvaccinated people in the community. It's their personal decision which will affect their personal health more than community health actually. So I don't see why we should, I agree that people should be motivated to put vaccine, but these sort of restrictions, uh, I think we should have a little bit of more liberal approach when it comes to that. We should definitely keep motivating people to take the shots for their own good health. But as far as transmission is concerned, I don't think it's really going to make any difference because no study has ever shown that transmission gets cut because of vaccination.
Okay, Swapneil,
So,
last word to you. Yeah, Swapneil, last word to you. Because I know you're not convinced about the whole Omicron's going to be mild sort of proposition, and that's what's really divided doctors globally. It's not just in India. But I think we all agree that most of these restrictions make actually zero sense. They just literally make zero sense. Go ahead, last word to you.
I'm not saying the Omicron wave is going to be mild or severe. I'm asking, what is your reference point? Are you saying that the peak of hospitalization in the Omicron wave is going to be mild compared to the Delta wave? Yeah, very likely. Are deaths going to be lower in the Omicron wave peak versus the Delta wave? Very likely. Where the debate comes in is hospitalization at the peak of the Omicron wave going to be more severe than our health system can handle? And this isn't a comment on our immune memory or on our vaccination drive. It's on a comment on the lack of surge capacity in our health system. Earlier, Barkha, you mentioned that there are so many other diseases. You mentioned tuberculosis, you mentioned cancer, you mentioned dialysis. What happens to all of these individuals when there's a surge? Where do they go? Their hospital facilities get taken away. Like someone who has cancer, they have a significant risk of infection that increases when they access health facilities.
But maybe that's the capacity we were meant to build in this time with field hospitals and not have your mainline hospitals be completely consumed by COVID, Swapneil.
If you remember, Barkha, like a month ago, that's what we were talking about. We were talking about getting ready. Now we're here. The wave has started. This is week 1 of a 4 to 6 week process. So yeah, we should have, could have, would have, but we're dealing with the reality we have right now. And that's what we need to focus on, not how much milder is it going to be compared to the Delta wave. Is it going to be more or less severe than our health system can manage? Briefly coming to the point about vaccination. So we have to look at it under 3 sort of headings, right? The first is, what is the impact on reducing severe disease? I think it's exceptional. These are some of the, considering like the timeline that vaccines have been developed in, absolute miracle of science. Protection against severe disease has been maintained, what we're seeing across the world. In terms of transmission, so that was the initial hope. You vaccinate a lot of people and there's a significant impact on transmission. I agree that's taken quite a bit of a hit with the Omicron variant. I still believe there's some reduction in transmission that will be there even for Omicron, but not to the extent that is going to stop. So now there is a tertiary benefit of vaccination. Earlier it was you stop the spread by vaccinating, but now the societal benefit is you will keep the health system from getting overwhelmed. So there is still a benefit to society from a large number of vaccinations. The health system doesn't get overloaded.
So what should happen? I have to close now. What should happen at this point? I think we all agree that the restrictions are meaningless as they have been approached. What's the one thing that should happen that isn't happening?
We need to decrease the spacing between dose 1 and dose 2, decrease the spacing between dose 2 and dose 3, and expand eligibility for dose 3 to include everyone above 60 and anyone below 60 with comorbidities. So that's the most important thing, and start handing out high quality, high filtration masks in public places of congregation.
And also have clearer messaging that everybody shouldn't go rushing to hospitals, maybe set up helplines where people, your resources are better used with that than to actually restrict movement, because guess what? If you're going to insist on institutional quarantine, you are actually going to at some point have even fewer doctors at these hospitals, because doctors themselves will end up in this sort of quarantine space. So very complicated. I wish our politicians would listen to the science instead of the illusion of doing something which isn't really doing anything and is in fact hurting the economy, lives and livelihood. We leave it there. To Amit, Swapneil, Chandrakant and Subhashini, thank you. To our audience, I say this again and again, if you haven't even got your second shot, there is no excuse. Please go and get it now. So that's my little moral science lecture at the end, or public health message at the end of the show. Thank you for watching. We'll see you tomorrow. Goodbye. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.